All right. Well, thanks for joining. I'm Dr. Garrett Hallweg, and today we are discussing the life-saving treatment of ketamine, IV ketamine. So this is what I do when I'm not doing psychiatry. This is toe-in surfing on the North Shore. And this is my lovely assistant giving glory to God on a trail in Hawaii. She's also my wife. And this is our therapy dog, Miss Parker. She comes with us to work every day and helps kids with getting their technetium infusion, as well as she can help adults with IV infusion of ketamine. So I'm going to move through really quickly and then leave time at the end for questions. So jot them down as they come up. There is a stigma attached to thoughts of suicide. It keeps people silent from talking about these events. Part of the reason is family and friends feel helpless to do something about it. Thoughts of suicide don't have to be taboo. Typically, if you share with someone you love that you're thinking about hurting yourself or don't want to live anymore, you're taken to an emergency room, evaluated, then released home or taken to a psychiatric unit. After experiencing a psychiatric ward, I've listened to many patients that tell me they will never tell anyone about their thoughts of suicide again, further contributing to the stigma and suffering in silence. Now, what if there was a better way? What if there was something we could do about severe symptoms of depression and thoughts of suicide? In the next year, there will be 8.3 million Americans that will have thoughts of suicide. And as of 2012, Americans have on average 2 close friends or confidants. So we're becoming increasingly isolated. So the chance of us telling someone that we're having these thoughts are becoming less and less. Thoughts of suicide should be similar to chest pain. When you have chest pain, you tell someone and they say, get it checked out. You get an EKG, some laboratory work, then a stent is placed, diet, exercise, and stress management. We can reverse the condition. It should be the same for thoughts of suicide. You tell someone you have these thoughts of hurting yourself, and now IV ketamine can rapidly reverse depression and thoughts of suicide. Too often patients isolate themselves at home and cannot participate in doctors' appointments or treatment plans. So IV ketamine can bring you out of the pit of despair and rapidly reduce the severity of symptoms so patients can benefit from their doctor's treatment plan. A suicidal patient came to me on the Tuesday before the weekend of her brother's wedding. Even though she was in the wedding, she told me she wasn't going. She could barely get out of bed to come see me and didn't know how she was going to tell her family she could not be at the wedding. She was treated with IV ketamine Wednesday and Friday and got on the plane Saturday morning. Not one person attending the wedding could tell she had depression. She was able to enjoy the wedding without a date and faced friends and family with her less than successful career. When she came back, she resumed treatments and forever has great memories of her brother's wedding. This patient had already tried and failed 8 medications as well as TMS. This patient would have had a very different outcome if we had hospitalized in a psychiatric ward or started ECT. Fighting thoughts of suicide has become very personal for me. My friend has a debilitating illness called Huntington's chorea. He is a physician, and one late night after working in the hospital, a cab driver denied him a ride because the driver thought my friend was drunk due to his choreiform movements. Often sufferers from Huntington's chorea can experience depression or end up taking their life. It has become my mission to prevent this outcome. So IV ketamine is for the rapid relief of severe symptoms for a wide variety of diagnoses. You can use it for depression, bipolar, PTSD, generalized anxiety disorder, OCD, pretty much any diagnosis associated with acute suicidal thoughts or severe depression. Ketamine, or Special K as it's called, is used in the club scene and electronica music festivals. There's a difference, though, of ketamine used recreationally and as an anesthesia and as treatment for severe symptoms of suicidal thoughts and depression. Recreational ketamine is taken orally or smoked and has a wide dosage range with wildly ranging effects. Enthusiasts call it going down the K-hole. As an anesthetic, it's administered intravenously in higher doses. Now, when ketamine is used to control severe symptoms of depression, dissociation is the goal. And the dose is tightly controlled at a low dose infusion, and the infusion rate is carefully monitored to achieve this dissociative state. Heart rate, heart rhythms, blood pressure, and oxygen saturation is monitored during the procedure. Now, when carefully controlled for dissociation, IV ketamine can turn around depression rapidly. For many, it's nothing short of a miracle with instant relief. The dosing schedule is 6 initial treatments over 2 weeks. So Monday, Wednesday, Friday typically, and then Monday, Wednesday, Friday for week 1, week 2. Now, an infusion is over 40 minutes, but we allow for 2 hours for setup and recovery. You need a family member or friend as an attendant to drive you home after the procedure. And maintenance dose is usually every 1 month to 3 months, depending on your response. Some people are maintained on medications alone and don't opt for maintenance doses. Now, we use 3-lead monitoring with ACLS medications and oxygen and defibrillator for cardioversion in the event of rare side effects of an arrhythmia or something like this. But the most common side effects are for the drug-naive patient that's never been drunk or exposed to drugs. Dissociation can be disconcerting. It's an unusual experience. Now, other people have nausea and vomiting, but we control that very well in our treatment here by use of ondansetron in the procedure. Also, you can get elevated blood pressure and heart rate, but beta blockers are given to control this. Now, hyperacusis phonophobia, blurred vision. So you have disruption in some of the perceptual understanding or information coming in. And this all resolves immediately after you stop the infusion. Now, dizziness and unsteady gait or impaired motor skills, disrupted motor skills are also a common effect, but again, they go away right after. No driving or operating heavy machinery 24 hours after the infusion. Although I will say most people that do the Monday, Wednesday, Friday schedule, they have no problems working on the Tuesday and Thursday right after the infusions. Now, contraindications and interactions, including, this includes benzodiazepines. So benzodiazepines adversely affect the outcome of IV ketamine. We ask patients to be off of benzodiazepines 2 weeks prior to treatment with IV ketamine. Visceral can be used for 2 weeks leading up to the infusion if it is planned. Although Dr. Amen always reminds me of our mutual patient who had an amazing outcome when she received the treatment while on Xanax during the entirety of the treatment. Now, heavy use of alcohol can negatively impact the results of IV ketamine, and the reason will become easily apparent when we discuss the mechanism of action and realize alcohol's impact on GABA receptor. It's also suggested that patients be off of opiates prior to initiating treatment. Ketamine works by taking the brake off of glutamate, causing a glutamate burst. In order for this glutamate burst to be the most effective, patients can do some important things to get the most out of their ketamine treatment. Now, I talk with patients about these habits when doing the ketamine treatments, but I'm going to tie them together for you in how they relate to the cellular reversal of the mechanisms leading to depression. So sleep 8 hours every night. here are some good tips for sleep hygiene. You all talk about these with your patients, but they should be considered to ensure adequate sleep. Now, don't be afraid to use melatonin, trazodone, Remeron, Belsomra. Those would be preferred to get your patients the 8 hours of sleep that they need. Try to avoid Restoril, Ambien, Klonopin, Ativan, and benzodiazepines. These sedative hypnotics can work on the GABA system, and they can blunt the effect that we're getting from the IV ketamine. Proper nutrition is a must. I discussed using food as medicine. Whole foods, mostly vegetable, and not too much, no over-consuming. I address the over-consuming by using time-limited feeding. I'm a big fan of the 5-19 or 8-16 strategy to increase production of brain-derived neurotrophic factor, BDNF. Exercise every day, at least 30 minutes, and make sure you're optimizing vitamin D levels between 50 and 100 with 5,000 IUs per day. Also, stress management, very important. You know, getting rid of anxiety, getting organized, and watching for those thoughts. Positive social interactions increase oxytocin. So this is the natural stress hormone helping to grow new neurons. Healthy gut bacteria requires 3 steps: a good probiotic to seed the garden, a good prebiotic to feed the garden, and you gotta water the garden with appropriate water intake. Checking testosterone levels will reduce the chance of depression. Make sure to replace low levels. Dietary flavonoids to reduce inflammation. I advocate green leafies at each meal because inflammation contributes to depression. So cooking with curcumin is always good. Turmeric is great to put in your food as an anti-inflammatory, and anthocyanins, basically anything purple, are powerful antioxidants. I like the Okinawa sweet potatoes. Okinawans consume 65% of their daily calories from these potatoes and live healthy into their 100s. So 30 minutes of brain training with a brain gym every day. My favorite is brainhq.com. And check your genes to determine vulnerabilities. Now, Genomind produces a test of the BDNF, brain-derived neurotrophic factor. This restriction fragment allele is a protein involved in neuronal development and neuroplasticity. So potential risks exist for increased depression symptoms, impaired working memory, and altered stress response in methionine carriers. So we can also, not only can we check for vulnerabilities, we can do genetic tests and look at if you are going to respond to IV ketamine preferentially. So we can inform ourselves. Now this, if we tested, this wouldn't be an absolute deterrent from using the procedure if you were genetically less inclined to respond to the procedure. Now, does this work for depression? Does it work for suicidal ideation? Here's a study, a peer-reviewed journal that shows the results, okay? 71% of suicidally depressed reported a decrease in depressive symptoms within 24 hours post-infusion. So IV ketamine induced a rapid decrease in treatment-resistant depressive symptoms within 1 hour and lasted up to 3 days. This is not some esoteric joke of a journal. This is American Journal of Psychiatry from 2015 that I'm quoting. This is Journal of Clinical Psychiatry from 2010 that I'm quoting. Now, does it work for PTSD? Of course it does. 24 hours after infusion, PTSD scores were significantly better in patients treated with ketamine even after administration of a single dose. Okay, so again, I'm quoting JAMA Psychiatry 2014. Does it work for bipolar depression? You betcha. A single dose of ketamine quickly and dramatically improves depressive symptoms in bipolar depression for up to 3 days after infusion. Again, this is quoting Archives of General Psychiatry, 2010, modern and relevant peer-reviewed journal. Now, especially since it is associated with anti-suicidal effects. You know, the top 3 things that you think about in people that are suicidal in young adult males are drug use, schizophrenia, and bipolar. So this is a great way to reduce those symptoms and bring them into a different risk category of safety. Now, is it just placebo? How does dissociative intravenous ketamine infusion work? Well, 71% of subjects who received ketamine responded with the criteria of response. 0% responded that received an infusion of normal saline or placebo. This shows an incredible response. Nobody responded to placebo, and 71% responded to the treatment. So this is within 2 hours, and approximately 1/3 of the subjects who had shown a response maintained that response over 1 week. So how does it work? Ketamine increases BDNF release, affecting synaptic function and dendritic spine density. This produces rapid antidepressant responses, and I'm going to dig deeper to show you how that works exactly. Now, let's look critically at this life-saving treatment, because so this is the molecule for the compound. Dissociative intravenous ketamine infusion's mechanism of action needs to be explanatory across many diagnoses, since we see it is effective across a wide variety of illness. So for this reason, we become focused at the cellular molecular level rather than the neurocircuitry level. When we look at the cellular molecular level of depression, we know depression results from many things. Notable influences include stress on the brain neurotransmitters, activation of the HPA axis and cortisol, the immune system with its inflammatory cytokines, fluctuations of ovarian steroids, the gastrointestinal system, adipose tissue, and its related peptides, the microbiome, the cardiovascular system, for example, vascular endothelial growth factor, and of course your genes. These systems lead to an increased incidence of depression. So healthy, non-stressed neurons look like a healthy tree with plenty of leaves and roots, like on the left. Stressed neurons look like the one shown on the right. So healthy brain, healthy leaves and roots on the neurons. Stress makes cortisol and the brain receptors die. Now we zoom in and see dendritic spines. Healthy neurons with healthy spines are pictured on the left versus stressed neurons with diminished spines on the right. Healthy neurons, plump grapes, okay? Stressed neurons, dried raisins. Glutamate sprinkle makes the garden grow. So you're going to see this glutamate here that sprinkles down and makes this garden grow, okay? Pretty easy to see. Now, healthy brain, healthy garden of receptors, okay? Now, with stress, okay, so we get stress here, and this glutamate starts drying up, okay? So notice we don't have a glutamate sprinkle, and the garden isn't growing, okay? So with stress, the glutamate sprinkle dries up and kills the garden. The garden of receptors starts dying off with stress. Ketamine unclogs the glutamate hose, waters the garden, and lets the receptors grow. So we have ketamine working here at the NMDA receptor, and it turns the glutamate sprinkle back on and lets the garden grow, okay? And so glutamate flows and the garden grows. So other substances can ruin the soil and prevent the garden from growing. So if you are going to grow a healthy garden of receptors, we need to encourage our patients to take steps of weight management, nutrition, exercise, sleep, stress management, vitamin, and hormone rebalancing, anti-inflammatories, and get the garden to grow. So IV ketamine isn't a magic bullet. It isn't a one-stop shop. It can't do everything. It can reverse, but you have to do the lifestyle and maintenance And this slide ties together all of this because there's so many things that impact growing this healthy garden of receptors. And if you're not doing those in conjunction, which I talk to my patients about, I know you guys talk to us about, that's what Amen Clinics is all about. And so we can influence this healthy garden of receptors, because if we don't, and we have high insulin resistance, and we have high glucocorticoid stress, and we have poor energy, intracellular energy, and mitochondrial distress, we're not going to grow this good, healthy receptor, this garden of healthy receptors. So building healthy neurons from that fertile soil by doing all those lifestyle management will grow plentiful, beautiful grapes, okay? Now, for anyone who would like this, for the physicians on the call, or anyone who's molecular nerd like myself, who would like to dive deep, I will go into some detail at the cellular level for the next 9 slides. So hang in there if you're not into it for the next 9 slides. I'm going to try to go fast. The influence of repeated restraint stress on pyramidal neurons in the medial prefrontal cortex of rat is shown. Now, pyramidal neurons in sections of the medial prefrontal cortex are visualized after filling the cells with neurobiotin and using 2-photon laser scanning microscopy. These images show stress induces a reduction in the number and length of apical dendrites. So no big problem. This is what we saw before. These apical dendrites, and then stress reduces that. Now, how do you stress a rat? You confine them in a small space for a half hour. You drill some holes in a very small cone, or you can just switch their roommate really often, and they have to try to show dominance, and that stresses them out. And if you accept that as an animal model for human stress, then these are the neurons that you would see. These are the changes that you would see. These images show a magnified segment of that dendrite and with its spines at the point of the synaptic contacts with neuronal inputs from the medial prefrontal cortex. So repeated stress significantly decreases the number and function determined by electrophysiology, of the spine synapses. Now, under normal conditions, stimulation of the presynaptic neuron releases glutamate, resulting in the activation of postsynaptic glutamate AMPA receptors and depolarization. This causes activation of multiple intracellular pathways, including BDNF-TRKB signaling pathway, and the downstream kinases AKT, ERK, and TORC1, mTORC1 pathway. Really important. These pathways are essential for regulation and synaptic plasticity, a fundamental adaptive learning mechanism that includes maturation in increased spine head diameter and increase in the number of synapses. This process requires mTORC-mediated de novo protein synthesis of synaptic proteins, including glutamate 1, glutamate A1, AMPA receptors, and PSD95. All this is saying is this glutamate is sprinkling down and making these signals that tell the cell, hey, make some receptors, make the garden grow, okay? So glutamate is the signal that signals a bunch of other things, a cascade of other signals that says, make this garden grow. No big deal. Still with me. Repeated stress decreases the BDNF, okay? And mTORC1, signaling in part upregulation, negative regulator RED1, okay? Regulated in the DNA damage and repair. So there's different signals. Again, this ties back to those lifestyle modifications. If you're in a repair state, you can improve the quality of receptors. If you're in the build, so these are signals that are saying build receptors, okay? So other proteins that are involved in regulation of synaptic plasticity include GSK3, protein phosphatase 1. So all this is saying is when the stress happens, then glutamate dries up, you get spine synapse number and function to decrease because BDNF and mTORC1 system decreases, and the synaptic proteins turn off, like glutamate A1, PSD95, and there's a signal from the nucleus, RED1, that decreases or turns off the production of these receptors. The garden stops growing. Now, ketamine causes a burst of glutamate that is thought to occur via disinhibition of GABA interneurons, NMDA receptor antagonists, okay? The tonic firing of the GABA interneurons is driven by NMDA receptors, and the active open channel state allows ketamine to enter the blocked channel activity. The resulting glutamate burst stimulates AMPA receptors, which causes depolarization and activation of voltage-dependent calcium channels, VDCCs, okay? So leading to increased brain-derived neurotrophic factor and stimulation of TRKB, AKT, which then activates the mTORC1 signaling, leading to the increased synthesis of proteins that are required for synapse maturation and formation. Okay, so now here's a critical part. The GABA A modulator agonists are things like benzodiazepines, barbiturates, muscle relaxants, alcohol, propofol. Some so these lead to the anticonvulsant, sedative, amnestic, muscle relaxation properties. Okay, so what does all this mean? Ketamine works here. Ketamine works at the NMDA, turns off the tonic inhibition through the GABA A. Now, things like benzodiazepines that you're prescribing, like Xanax, Valium, Klonopin, Ativan, they're working at this GABA A, and they're interfering with this process. So we're not going to get the glutamate burst that we want to see. So that's why it's really important, if we can, to avoid these things when we're giving the IV ketamine infusion, okay? So what we're doing is we're sending it this way. We're sending it this direction. The glutamate burst is sending it this direction. Now, over time, relapse will send it back this direction with stress and cortisol, inflammation, diabetes, obesity, cardiovascular disease. All of these changes are going to send this back this way into the disease state. Now, we're almost through these tough spots. So pathways that affect synapse formation include neurotransmitters, glutamate, growth factors, and neurotrophic factors, GS, NTS, cytokines like tumor necrosis factor A, energy and metabolic factors, ATP, amino acids, sex steroids like estrogen, HPA axis, glucocorticoid, cortisol, okay? These influence multiple intracellular signaling cascades that regulate all aspects of neuronal function. So what does this mean? Again, all of these intracellular systems are affecting the growth of these receptors. Synaptic plasticity involves several processes which brain undergoes neuronal change. So this slide is to remind you that with the regulatory, this slide before that we showed is involved in long-term potentiation, or this is the model, the cellular model of learning and memory. Now, long-term potentiation or long-term depression, I included a slide that reminds you of how this works. So you give a stimulation to a neuron and you get a certain signal, but the signal is low in certain ways. Then over time, as you give it repeated stimulation, as you exercise this, which is basically the same thing I do in TMS, transcranial magnetic stimulation. Over time, I'm stimulating certain neural circuits and I'm potentiating them. I'm giving them I'm exercising them so that they build up these receptors and they have a better response at stimulating. So now, after repeated stimulation, I give them a stimulation and I get a bigger response. I get the response that I'm looking for, and I overcome this dull response of depression. So the glutamate burst is a way to rapidly reverse and get me back to this state. Now, the opposite works too, and this is the process in the hippocampus or the cerebellum, where you might need some information for just a quick time, and then you need it to just drop away. So these are quick learning systems. And how this works is you give it a burst, and it over time will decrease. You have a lack of stimulation, and over time the garden dries up, and then subsequent stimulations will have less of an effect. So that's called long-term depression. So ketamine works by disinhibiting glutamate, turning off tonic GABA secretion via NMDA receptors. Healthy habits grow the garden, but intracellular factors causing depression, relapse, kills the garden. Okay, so now for those of you who like QEEG, the findings of frontal midline theta excess, like in this picture here, this is a QEEG marker for treatment-resistant depression and OCD, which resolves with IV ketamine. So if you ever see this on your QEEG, it's a very good candidate for IV ketamine. Now, I am going to unmute and allow for any questions that you might have. So feel free to ask any questions, but this completes the didactic portion.
Thank you, Dr. Howick. That was really helpful. I think a lot of people had to jump off for another meeting.
No problem, my pleasure.
So I have just a couple of questions. One is there anything we can look at and inspect that would help us to determine if someone's a good candidate or not?
Yeah, that's an excellent question. So SPECT is looking at perfusion and neuronal cell metabolism. So this is because we're looking at the cellular mechanism of action. SPECT isn't the ideal test to look at, you know, how someone would respond. There is no data or literature that, you know, currently supports a correlation with SPECT findings as to indication or, you know, the application of IV ketamine or predicting its response. So while it's still early and we don't know what we can find, there's nothing currently melding these two aspects together. But of course, we're, you know, I'm very interested in this and would like to make that association so we can, I think for our purposes right now, the biggest thing that I would say is that getting someone out of that pit of despair and getting them back into a healthy state allows them to participate in their treatment, allows them to get, you know, back to a place where they can actually go through a full evaluation process. I've heard from the call center that, you know, they get calls from desperate parents who, again, these things are very taboo, are very, there's a lot of stigma and shame surrounding thoughts of suicide and severe depression, or their children are isolated at home. I think the big role of IV ketamine can be getting them out of that pit of despair, getting them out of their silence, their suffering in silence, and getting them to participate in their care, getting them a good evaluation, and getting them on a good treatment plan. Because if they get on the right medication, they're stabilized on the right medications, you know, they don't have to, they might not even have to be on IV ketamine for maintenance, or you know, they obviously can go about their lives or get productive again in their lives.
Cool. Is this indicated for children?
So ketamine has been used in children in the ER setting for a long time now as an dissociative anesthetic to set broken bones and do different procedures. It can be safely used in, 5 and up. Now, we would be very careful in treating someone, I would say, maybe under 15 to reliably determine whether those suicidal thoughts were just acting out,
Mm-hmm.
and the family system was disrupted. And I'd want to really dive into the family system. But if you have any question about whether this patient is appropriate, it's best to just set up a consult. This can be easily scheduled with my assistant, Asia, or just put it on my schedule. As all I need is really about a half an hour with them and kind of determine their appropriateness. I want to make this really easy for any provider to be able to easily put them in front of me and have a conversation. They can also just call me directly and say, hey, I have this patient I've been thinking about. What do you think? We can discuss it. We can discuss, what medications might affect their treatment or give them the best outcome. Send them out, and we'll get them treated and then get them stable.
Wonderful. I don't know. It looks like somebody called in. I'm not sure who that is. The area code 307. Is that you, Mindy?
Yes, it is.
Hey.
All right.
Sorry,
Any questions on these calls?
Wyoming today is stunning. Spring, summer has finally hit. We've had a very freaky, floody spring, and it actually snowed last week. So.
Oh my gosh.
Yeah.
Wow. Well, welcome to the